The first thing that we're going to do in the medication room is to verify the doctor order against the MAR to see if they're the same. Then I will wash my hands and pull up the medications that are needed. The doctor has ordered 10 units of insulin and 2 milligrams per 1 millimeter of Dilaudid. The pertinent lab information for each include insulin, we need to look at the last blood sugar level, and Dilaudid, we need to look at the last pain level score. The first check of the medication is to look at the vial, check the expiration dates, and then the integrity and its contents of the vial. So for insulin, our expiration date reads 8 of 2027, and the integrity and the contents of the vial appear to be in good condition. For Dilaudid, our expiration date reads 8 of 2027, and the integrity and the contents of the vial appear to be in good condition. Next, we are going to draw up our medications. We'll do insulin first, and I will wipe off the top of the vial with an alcohol prep pad. The order read 10 units of insulin, so we will draw up 10 units of air first and insert that into our vial. Then we flip it over and we draw up 10 units of insulin. Now we'll recap our needle. Before I leave the medication room, I will double check this accuracy with another nurse for the insulin. Next, we'll draw up the Dilaudid. Again, we're going to clean our vial with an alcohol prep pad. And the order was for 1 millimeter, so we'll fill up the syringe with air for 1 millimeter and inject the air into the vial. Flip it over, and we're going to pull up 1 millimeter of Dilaudid, and we're going to recap this needle. And as you can see, I have 1 millimeter of Dilaudid and 10 units of insulin. Next, we are going to switch this needle for the needle that we're going to be giving the IM injection for. So we're going to remove this needle and place it into the sharps container. Now we don't want to touch the adapter of the syringe nor the hub of the needle because they are sterile. Secure, and it's ready to go into the client's room. Next, we'll do our second check of the medication again. We're going to check the MAR. We're going to check our vials to see if we have the correct medication, which we should have insulin and Dilaudid. We're going to check our syringes to see if we have the appropriate amount and correct medication. I have 1 millimeter of Dilaudid and 10 units of insulin. Again, before I leave, I will have another nurse double check the insulin for accuracy. Questions to ask myself in the medication room include checking the medical history, the medication history, known allergies of the patient, height, weight, and age of the patient, and we're going to double check those labs pertinent to what medications I'm going to be giving. Then we'll gather all of our supplies to take to the room, including our gloves, our vials, and our syringes, and also the MAR. I'm going to knock on the patient's door and introduce myself. I'm going to tell the patient what I'm there to do, and then I'm going to wash my hands. I'm going to identify the client with 2 identifiers. I'm going to check the wristband while they tell me their full name and date of birth. And now we're going to do our third check of the medication. We're going to check our MAR, check our vials, and check our syringes. I'm going to ask the patient if they have any known allergies, and I'm going to test their alertness. So I'll ask them their name, where they are, and what day it is. Next, I'm going to assess their knowledge of the medication and ask them, do they know why they're receiving these medications? If they say yes, I'm going to ask them when they last received it and where on their body they last received the medicine. I'm also going to assess their lower extremity movement to see if they're able to move their hip and legs for the injection. I'm going to delegate assistance if needed. Next is time to put on our gloves. While I do that, I will tell you the landmarks for the IM and sub-Q injections. For sub-Q, our landmarks include the abdomen, 2 inches away from the umbilicus, and then the posterior side of the upper arm. The abdomen is our preferred side for the insulin injections. For IM, the landmarks include the ventral gluteal, vastus lateralis, and the deltoid. Today we're going to be giving our IM injection into the ventral gluteal. For giving the IM, we're going to rotate the site of the injection from the last site that was given. We're going to make sure that we're using the appropriate size needle, which in this case today we're going to use a 1.5 inch needle. We're going to inspect the skin and palpate for bruises. We're going to ask the client if they're in a comfortable position and tell them to relax the site where it's going to be given. We're going to give the shot in the Z-track method while stabilizing with our non-dominant hand. First, we're going to clean the skin with the alcohol prep pad, and we're going to loosen the top of the cap of our needle before injecting. Okay, now for the Z-track, we're going to pull the skin taut, and we're going to inject the needle and stabilize with our non-dominant hand while inserting the medication over 5 to 10 seconds, keeping the skin taut. Then we release our hands, and take a gauze pad to stop any bleeding that may be occurring from the injection. I would then put on the safety of this needle and discard it into the appropriate sharps container. Next, we are going to do our sub-Q injection. Again, we are going to rotate from the last site given for the injection site, and we're going to inspect the area and palpate for bruises. Again, we're going to ask the client to relax and put themselves in a comfortable position. And since my client is overweight, I'll be sure to grab 2 inches of skin for the subcutaneous. We are going to cleanse our area with an alcohol prep pad. I'm going to loosen up the cap for the injection. And now we're going to grab 2 inches of that skin. Grabbing 2 inches, take our needle, insert, release my fingers, stabilize the needle, insert over 5 to 10 seconds, release, put the safety onto the needle and dispose of it into the appropriate sharps container. I would then put a gauze pad to remove any bleeding that may have occurred. Now is our evaluation. We're going to clean our area, clean up our patient. I'm going to remove my gloves and wash my hands. I'm going to put the bed in its lowest position, side rails up ×2, put the call light next to the patient, assess their level of pain, inspect and palpate both injection sites for lumps and bruises, and I'm going to document the medication that was given on our MAR.